Hello and welcome. I'm Scott Dennis.
And I'm Jacqueline Matter. Thanks for joining us. Our top story this hour, it's often reported that the Suncoast is the epicenter of the opioid crisis here in Florida. The state legislature continues to work on a bill that would put strict limits on doctors prescribing opioids.
But an ABC7 investigation has uncovered some local doctors are writing more prescriptions than just about anywhere else in Florida. Tonight, one of those doctors speaking to ABC7's Alan Cohn about why.
Dr. Lindsay Job is the next generation of pain management specialist. Vanderbilt educated, she's an anesthesiologist and board certified in pain management. But when she moved to Florida and joined a pain management practice on the Suncoast, she was astonished, and not in the good kind of way.
I didn't know what to do with myself. I was thrown into very, very high dose narcotics. I had never seen anything like it before, and it was scary.
The Suncoast, as we all know by now, is ground zero in Florida's opioid epidemic. But the battle isn't just being waged on the street, and the enemy isn't only illicit opioids like heroin, fentanyl, or carfentanil. It's also being fought in nice, well-maintained medical office buildings throughout the Suncoast. And the opioids aren't just dangerous concoctions imported into the country by drug cartels. They go by the name of Percocet, Vicodin, hydrocodone. And despite the crackdown by the state and county on so-called pill mills, they are still being prescribed at alarming rates, says P.J. Brooks of First Step, one of the Suncoast's preeminent substance abuse treatment centers.
Even the general practitioner who may be prescribing doesn't fully understand the impact that those medications could have. The medical community as a whole typically only has about 2 hours of training on addictive disorders. They don't really even understand the disease of addiction.
So ABC7 set out to find out who is writing the most prescriptions for opioids on the Suncoast, why, and what are the alternatives for treating very real pain. We obtained this database from the Center of Medicare and Medicaid from the years 2013 to 2015. It contains the names of every doctor in the nation who has prescribed opioid pain medication to those enrolled in those programs, how many prescriptions they wrote during that period, how many refills, and the total drug cost. We narrowed our search to Florida, and ranking third in the entire state, Dr. Fabian Ramos, who has offices in both Sarasota and Bradenton.
If you are very busy, if you see 200 patients a day in the practice in general, you're going to generate patients, especially if you're working 18 years in the community, in 2 cities.
In other words, Dr. Ramos says, it's a matter of the volume of patients he and his staff treat and doesn't reflect the level of the dosages. From 2013 to 2015, over 8,500 patients going to the Ramos Center received prescriptions for opioids. The number of prescriptions of refills, almost 42,000. The total cost of the medication, more than $2.5 million.
When you look at the Florida list and you in the practice ranking third out of all the pain management doctors or physicians in Florida in terms of the number of opioids and refills and the dollar amount, put that into context for us.
Actually, I am the practice, one of the that least prescribes per patient. We are the largest practice in the area.
Ramos claims only 21% of his patients are prescribed opioids.
Keeping them functional, keeping them at work. Sometimes, it's okay to do that.
Dr. Job does prescribe opioids as well, over 1,000 times from 2013 to 2015. Total prescriptions and refills, over 4,000. But she says,
my generation trained differently. We were trained with very minimal opioids, and we were trained to use, this super high technology that we have now to make pain go away.
Job says that technology includes using a device like this to inject stem cells and blood platelets.
This is a chamber that we use to purify, essentially, components of the blood to inject platelet-rich plasma or bone marrow aspirate into patients, typically joints, for chronic pain syndromes.
But neither are approved by the FDA or covered by insurance for pain relief. Dr. Ramos says he is all for innovation as well and screens patients for addiction, personality disorders, depression, and offers mental health counseling. But when it comes to pain and patience, he implores, don't just look at the numbers of traditional opioid-based pain medications he and others prescribe.
We have the obligation to treat the human being in pain, and this is when the pendulum should not swing to the nonsense.
In Sarasota, Alan Cohn, ABC 7, your Suncoast News.